Thank you for listening to this PYA webinar recast. PYA is pleased to offer this alternative way to access our thought leadership. This is a recording of a previously delivered webinar. The information is accurate as of the date of the original event. The video recording, slides, and associated material for this and all PYA webinars are available on our website at pyapc.com. This podcast is for educational purposes only. It is not intended to be used as legal advice or an official opinion.
Welcome to today's episode of PYA's Healthcare Regulatory Roundup webinar series. Today's topic is Top 10 Healthcare Compliance Risk Areas Managers Need to Know. PYA is happy to present today's webinar on this important topic. With that, I would like to introduce our presenters, Shannon Sumner, Miriam Murray, and Katie Croswell.
All right. Thank you, Jen. And it's great to be with all of you today. We're very excited to be presenting these topics. We're going to actually have some fun today. I know compliance is a world that many of you live in, and sometimes that can be challenging, but we want to make it a little bit more fun today and cover some of the topics that we're hearing a lot of our clients talk about as we conduct compliance program assessments, risk assessments. Shannon Sumner. I'm also joined today by my colleagues Miriam Murray and Katie Croswell. And let's go ahead and get started. So when we think about the listing of the topics that we want to present to you today, as I mentioned, a lot of these are topics that we're hearing front and center that our clients are concerned about. Maybe it's a topic that's on a compliance work plan. Maybe these are just some tried and true, good old topics from compliance. So you're going to see some of the familiar faces for the different types of risk areas. We're not going to cover all of these to the same amount of time, because when you think about, there's a lot of topics to cover, but there are some that we're going to spend a little bit more time than others, particularly in the areas of cybersecurity, data breaches, AI, digital transformation, and digital care. So want to go ahead and get started with some of these. As always, if you have any questions on the Q&A, we do monitor those. We want to hear from you. And I know we could have put a whole nother list of maybe top 20 risks on this listing for you today. But as for many of you that actually attend these webinars on an ongoing basis, we always want to hear from you. Is there a particular topic that you would like for us to drill in a little bit more, maybe spend a little bit more time, or are there topics that you like to share with us and we can present those in a future webinar? So let's get started. So one of the areas that we hear quite frequently when we do any type of compliance program assessment or risk assessment is the fact that many of you in your organizations are working with outsourced service providers more and more. Healthcare is very complex. We all know that we can't really focus everything for our patients if we're not the best at doing a certain type of procedure or a certain type of service. So we're seeing a lot more of these outsourced service arrangements, particularly in the areas of clinical staffing services, medical directors, technology and software updates, recruiting, coding, billing, the list goes on. And if you're familiar with it, we're going to talk about it in just a moment. The Department of Justice's evaluation of corporate compliance programs, there's a whole section on ensuring that if you are conducting any type of services for your organizations by the use of outsourced service providers, there's a whole host of different types of risk areas that you need to be monitoring for, and we're going to cover that in just a moment. When we think about the risks that an outsourced vendor could introduce into the organization, certainly it's risks that could really truly affect how you document your medical records, ensuring the right level of medical necessity, with the high impact related to privacy, cybersecurity, and HIPAA. We all know, for those of us who are business associate agreements, and for those of you who work very closely with business associate agreements, that's probably one of the biggest kind of explanations in terms of how do we ensure that we're mitigating risk. Is if you look at a business associate agreement, there's so many different nuances related to that, as well as some of your more significant contractual relationships with your third-party vendors. They impact your conditions of payment, your conditions of participation, and then, of course, you always have to be mindful of the background of a particular vendor, because they can certainly introduce fraud into your organization. One area that I think we hear over and over again is that, yes, we have outsourced a particular service to another vendor, but as we all know, we cannot outsource the responsibility for effectively monitoring and mitigating the risk that can result from that particular vendor. So what are some of those best practices? Again, when we're having those conversations with our clients and asking, how are you ensuring that you have proper controls in place to mitigate those risks? The first thing that we ask is, how have you taken a really good inventory? Do you know in particular who are all those particular vendors that you're using to outsource certain services? The first thing to do is the due diligence. As you are entering into any type of an agreement, there's going to be a couple of things that we're going to talk about in just a moment related to what exactly do I need to be mindful of when I have either introducing a new vendor into the organization, or we're re-engaging with the vendor maybe through an extension of an arrangement. So first of all, within the agreement, what are you monitoring? How are you ensuring that those particular vendors are actually adhering to your standards within your health system, within your other types of organizations, and are those expectations clearly documented? Many times we see wonderful contractual relationships that are defined in written agreements. However, where we see things fall short is upon execution. Who are you ensuring and entrusting that task within the various departments, service lines, processes, maybe some joint ventures? Who's actually going to be monitoring those particular arrangements? Do you have the right level of indemnification and insurance relative to the risk? Especially if you have a vendor that has access to your data, and these are the things that Miriam's going to talk about in just a moment, you have a heightened awareness of the risk and how many fines and penalties could pile on if you have a HIPAA breach, if you have any type of a cyber event, ransomware within your health system or organization. Policies and procedures. How closely are you aligning with your purchasing department, your supply chain department, in terms of how are they contracting with those vendors? How are they ensuring that those vendors are adhering, again, to your own vendor management policy? And do you have a vendor management policy? And finally, auditing and monitoring. Again, who's doing it? What are you monitoring for? Are those expectations clearly outlined in your agreement? So let's get into this a little bit more. So some of those examples of third-party vendors, and I know many of you could probably add to this laundry list, medical device manufacturers. Think about any device that is capturing patient information, your biomedical equipment. Do you outsource that to a third party because of the complexity of those certain types of medical devices? Are you outsourcing that to a third party to manage and hopefully mitigate risk? Everything from there to cloud service providers, data analytic companies, and we're going to see more and more and more of those companies be introduced into your environment. Consultants, advisors, who do you use to engage with on a daily basis, and do you have a good laundry list of those, a good inventory? Billing and coding firms, I know these have been around for a long time, but as the complexity of your services are introduced into your organization, you're probably engaging in various types of billing and coding firms that may be very specialized for those certain services. Lab services, EHR, and the list goes on and on. So when we think about a new concept, at least in the last probably 5 years, it's called third-party risk management lifecycle. As I mentioned earlier, you're going to do your due diligence. Hopefully, you're going to onboard. So when you initiate that relationship with the vendor, how are you engaging with them through that due diligence and that contract setup? The risk assessment. When you conduct a risk assessment for a new vendor, are you evaluating those potential risks such as compliance, financial, operational risks? Again, monitoring, that ongoing oversight of that vendor performance and risk indicators. What are those areas and the things that you really want to ensure that those particular vendors are monitoring within those financial and operational arrangements? Performance evaluation. So you're going through the life cycle, you've onboarded them, you've brought them into your health system or your other types of healthcare organization. You are monitoring them, but what are you monitoring against? Do you have very concrete and specific performance metrics that you are evaluating that vendor? Are you reevaluating that? So as you go through the life cycle, think about it, it is a life cycle. Are there certain areas that you may, at the beginning of your relationship, you may not have had that vendor work with you, but as you go through that particular relationship, are you consistently and monitoring, are they still evaluating the things that you had engaged them to do? And then a lot of people don't think about, well, when we're done with this relationship, how do we offboard them? Who owns the data? What are those services now that you are bringing, particularly if you're bringing those in-house? Do you have the right skills and competencies also to make sure that when you're offboarding a vendor, you're not also reintroducing risk into your organization? So do your homework. These are some of the topics that you'll hear related to those due diligence considerations at the beginning of the relationship and also through that life cycle. Data security and privacy breaches. Have you engaged in doing that due diligence to ensure that those vendors have not had a particular data breach? Or if they have, did they have appropriate corrective action plans? What type of maybe a regulatory non-compliance or a settlement agreement have they entered into? Or were they under, or are they currently under a corporate integrity agreement or a non-prosecution agreement? What types of cyber incidents and security ratings do they have? Many organizations now have scorecards that when they are onboarded to an organization, they have certain contractual expectations that are spelled out into an onboarding checklist. But there's also some type of rating. Have they had a breach? Have they had a security incident? And are you aware of those particular ratings? Conflicts of interest. If they are a device manufacturer, what types of relationships that you might have with your providers within your organization that has maybe a contractual relationship with a medical device manufacturer or a pharmaceutical manufacturer. Look at your open payments. There's the CMS open payment registry that can really give you a lot of great information in terms of if that particular vendor has a relationship with your organization. Compliance program maturity. As you look at the types of services that the vendor will be introducing or assisting you with, do you have an understanding related to how well their compliance program, how mature is it? Do you have expectations that are spelled out within those vendor contracts related to their particular compliance program? How stable are their financials, their operations? Look at any type of, if they're publicly traded, they should have publicly available financial statements. Look to see how they're rated for that, introducing that to your organization. You want to make sure that they have a very stable environment, both operationally and financially. And finally, the excluded providers. I know Katie is going to talk about a little bit later today, but have they been excluded from participation in any of the Medicare, Medicaid programs? And then one area that I really could probably spend a whole hour talking about is the evaluation of corporate compliance programs in the Department of Justice. So the most recent update was in September of 2024. There's an entire section on third-party risk management expectations. In fact, it talks about, for many of you that are familiar with this particular document, it actually gives guidance to the prosecutors. So if you have any type of fraudulent activity that's being investigated by the prosecutors, They say that some prosecutors should also assess whether the company knows the business rationale for needing a third party. So again, once you enter into a relationship, have you appropriately documented why you needed a third party? Because it does say that organizations can outsource services all the time, but again, do you have a good rationale for doing so? And a prosecutor should analyze whether the company has ensured that the contract terms with third parties specifically describe those services, that the third party is actually performing those services, and the compensation is commensurate with the work being performed. So if you haven't had the opportunity to read this document, there's so much more than just third party risk that is being explained and discussed. But for this topic, ensure that you actually take a look at it. It's for your references. It's on page 8 and 9. Again, they talk about the risk management approach. Do you have appropriate controls for third-party vendors? How are you managing those relationships? And are there real actions and consequences for failure to perform? So the next topic that we're gonna go through, when we were preparing for this, is kind of like speed dating in terms of some of those top risk areas. So we're gonna speed date through this one: administrative compensation and compensation stacking. Want to do a quick kind of a commercial break. We actually, within PYA and two of my partners, Lyle Ulrich and also Carol Carden, this is an oldie but a goodie. This document is actually a white paper called Compensating Physicians for Executive and Administrative Services. We can send this out later, a link to this, but it's actually, if you just Google that and PYA, it'll pop up. But it is a great white paper that covers a lot more in depth of what we're going to talking about today. But again, looking at your compliance work plans, if you haven't, ensure that you have some level of auditing and monitoring for any types of providers that are providing those types of administrative services. And we're talking about administrative services and those roles. So it'd be like your chief medical officer, it could be a clinical service line leader, a director maybe of a service line institute, any type of independent providers that you are engaging them to provide some type of administrative services. This is a risk area. Again, we see great contracts that have been created for entering into these types of relationships, but a lot of times they fail in execution because payments are being made without supporting documentation. If they're requiring timesheets, which you should, the timesheets are not being completed. There's cut and pasting situations with time, or they're being compensated for administrative duties that are part of their other duties. So are those clearly defined, and are they challenges? Value-based pay, value-based metrics. Again, are you ensuring that you're monitoring those? Because if not, they're going to be what's called double dipping as well. Compensation stacking, the topic is covered greatly in this particular white paper, but stacking is a situation in which a physician or provider is paid for the same services twice. Or you could have where you have a financial relationship. It's a compensation relationship for clinical duties. That is purely within fair market value. You have another arrangement with that provider related to administrative duties. That could be completely within fair market value. But when you stack them together, those types of services and also the time that the provider is committed to those services could be outside of fair market value. Could they really be performing all the duties that they're having in their private practice, and then you layer on the duties that they're being asked to perform within your facility? Could they really truly perform those types of services? We have an example here of where we did that with a provider, and those services added up to over 2,000 hours just in their private practice. So that was not, again, commercially reasonable for them to be able to do that. With that being said, I know that was fast, but I want to get to probably the area that's on top of many compliance work plans, top of mind that we're seeing within boards, audit committees, compliance committees. But I'm going to turn it over to my colleague Miriam, and she's going to get into some more of this fun stuff related to cybersecurity and data breaches.
Absolutely. Thank you, Shannon. So the next three topics are all interrelated, and they even tag team with the vendor management that Shannon just talked about as well. So you'll hear some common threads as I go through this, but cyber risk is increasing, and it's all because we're using technology. Our computers, our phones, our iPads, our watches, software applications. These are all susceptible systems. And, the bad actors, as I like to call them, they're clever. I mean, and they're figuring out new ways to get into our systems every day, every hour, probably every minute. And here are some of the ways that they are getting in. Obviously, ransom attacks, we've all heard of them. They're getting into the systems, corrupting our data, getting into the electronic health record, accessing PHI, cloud-based services ever since, we've been doing remote-based services over the last several years. You don't think about, the web-based EMR, our payroll system. That's another one. File storage, SharePoint, OneDrive, those are all susceptible systems as well. Medical devices and their vulnerabilities, you've got an operating system talking to a clinical system. So the vulnerabilities are unauthorized access, data breaches, the device is malfunctioning, or other clinical disruption that could affect patient care. And then our third-party software vulnerabilities as well, as Shannon just talked about, our third-party vendors, understanding, their systems, how they are using them, how they are accessing our data. Are they updating their security? Are they doing it timely for patches or full system updates? In a lot of cases, they sometimes don't have as robust systems as we do in the healthcare industry. And sometimes they're a little delayed, which could cause a risk. And then, of course, unauthorized access. And then human error. Well, we're all human. Those happen all the time. And then phishing. Phishing is a biggie because it's constantly happening, and they're really clever because they hide it so well. I was just dealing with a client just this past week on a privacy incident where the employee had clicked on a link inappropriately, causing a bad actor to get into the system. They accessed their email. Unfortunately, there was some PHI in those emails, which caused a privacy data breach. So it dominoes very quickly. Luckily, this client had a very robust security system, saw the abnormalities with the login, and they were able to shut down the bad actor pretty quickly. But these happen, and they happen really quickly, and sometimes without your knowledge. It's just they're sneaky. So they're just happening, and they're happening all the time. And healthcare is at the top of the list for cyber attacks. And these hackers are getting in there, and they have pivoted a little bit to now start going after the third-party vendors, i.e., you need to do your due diligence and do your security assessments of your vendors to understand what they're doing and how they're accessing your systems and what data. I thought this was interesting, and I just saw this over the last couple of weeks when they released the December from OCR that there were 697 data breaches and 60 million people impacted. And just the other day, I received a notice from, we'll just call it a person I was dealing with, and they said that they had somebody get into their system and they wanted to let me know that my data may have been stolen. Oh, yay, thank you. So it's happening to all of us, and we're all being impacted. But where some of these PHI data breaches are happening with our third-party vendors, our IT service providers, our business associates, and they're getting in and they're taking that PHI. So one of the number one reasons is human error. It happens, and we need to make sure all of our staff all of our team members, all of our vendors know how to appropriately access systems, and that we are being careful with monitoring access, terming access appropriately and timely, especially for employees who are no longer with the company, or that vendor is no longer with the company. We need to make sure we've got processes in place to appropriately take those people off of our systems and get them out before they can do any additional damage. Monitoring your business associates, making sure you've got strong IT policies in place, making sure that when you are doing risk assessments, that you are looking at what was the causal factor. Go all the way down and look at the root cause and take appropriate action, and take those mediation plans and educate. Use those examples in your training so that others can learn how to appropriately address potential risk. And then your business associates, as Shannon already said, make sure you've got them. You've got those agreements. They're updated. They're enforced. You've got an inventory. We're going to talk a little bit more about that as well. And then strong access, making sure that you've got multi-factor authentication when appropriate, that the people who are accessing your system are accessing it only for the minimum necessary allowed for them to do their job. And then review your access. One of the things as compliance or as compliance auditors or officers, you're going to want to make sure that there's a process in place that you're doing at least quarterly access reviews. You tend to forget, oh, that person was a temp. Maybe I don't, and then they're no longer there, but oops, we forgot to term them out of the system. So it's important to make sure that you've got some processes to audit and monitor the controls. Oh boy, this is a good one. And it's happening all the time. It's rapidly expanding, and I'm talking about artificial intelligence. A question: are you personally using AI currently? Have you thought about ChatGPT, Copilot, Gemini, Grok, voice assistants such as Siri, Google Assistant, Alexa? Alexa's been around for a long time. Photo enhancement tools. These are all AI. The last time I was texting, it was automatically giving me a suggestion of what I wanted to say next. That's all artificial intelligence. It is here. It's here to stay. So now we have to figure it out. So what questions do we need to be asking? And the questions that are being asked now by healthcare leaders are, what tools are we using? What AI systems are we using? Where is it? Who's using it? How's it being used? And does it include protected health information, which is a big one for privacy? So making sure you've got an understanding of the information that is out there and how it is being used. AI is not a bad thing. It is actually really a positive. It is going to be helping us operationally. It's got its clinical advantages, but we've got to make sure that we have oversight in place to understand how these systems are being used and who's using them and how are they using them. And does it have clinical decisions that are being made or suggested to be made? So some of the things to think about from a risk mitigation strategy is setting up an inventory. And that's almost like the first thing you want to know. What is it that we have out there in our organization? We know everybody's using it, or at least a lot of people are. So you need to do a comprehensive inventory. Then you need to do an AI-specific risk assessment, such as how's it being used, who's using it, what decisions are being made. Those fall under what we call an AI governance committee. If you don't have one in play yet, that's okay. Many organizations don't yet, but they are starting to develop one. So your AI governance is going to be your committee that is looking at everything that you're doing from an AI perspective, all the systems and how they're being used. And are they being used appropriate? And who needs access to those AI tools? How is it being configured to ensure that access is only generated for minimum necessary requirements? You've got to make sure you've got good, strong technical safeguards. We've talked about that. We talked about that for cybersecurity. You've got to make sure you've got AI-specific policies and ensuring that your workforce is aware of what those policies are and how to find them. Can't tell you how many times I've had employees go, yeah, we've got a policy, but I don't know where they are. So make sure that your staff, all your leaders, understand where the policies are and how to find them, and make sure that they're being appropriately trained and are effective. Having a policy in place and it not be effective is almost like not having a policy in place in the first place. Making sure that you've got some monitoring and auditing going on of your AI systems and the tools that you are using. For example, if you are using a tool that is reviewing the medical record and suggesting coding, periodically you are going to want to have an independent audit of that system to ensure that the system is appropriately giving the suggestions and that there is not bias in the tool that's being used. You've got to have an incident response protocol. That's a policy. Typically, most compliance programs have how to report, how to respond to incidences that are reported. And we talked about the business associate oversight already, as well as due diligence. These are all part of setting up a good strategy to address artificial intelligence. So the key takeaways that you want to have in place, work with your leaders, your IT team, to ensure that you've got an organization-wide AI inventory. Monitor the evolving laws and regulations that are out there. They are coming if they aren't out there already. And I can almost guarantee you that the state governments are probably going to jump on board as soon as federal makes their decisions as well. And then, adapt your privacy, security, and compliance strategies to standards, as AI capabilities are going to continue to change. You've got to make sure that you've got good security protocols in place. And then, prioritize your patient safety by understanding what the risks are, applying safeguards, and embedding compliance in literally every stage of AI adoption. All right, digital transformation. So we've talked about cybersecurity and data breaches, talked about artificial intelligence. Now we're going to move into data transformation. Well, data transformation has been going almost since computers were implemented. That's your start of digital transformation, is when computers came around. And then we evolved into telehealth. Telehealth has been around for a good long while as well to address care for those individuals who were located in rural environments. And then it exploded, obviously, in 2019, 2020, when we had COVID. It is not going away. Telehealth is going to be around as an alternate care delivery model these days. So we've got to make sure that you understand what all is included. You've got your electronic health record. Now everything is in the electronic health record. A lot of revenue cycle functions are being automated. You've got AI-assisted clinical documentation. That's the ambient assistant. Used to be transcribing. They are transcribing directly into the electronic health record now. But again, if you are using an AI assistant, you still have the responsibility to review the record and make sure that the information that was captured is accurate in the record before signing off on it. And then you've got digital onboarding, patient intake. You've got the iPads. I don't know if you've gone to the doctor lately, but a lot of your check-in process is electronic. You can do it on your phone. That's another digital transformation. So we have a lot of digital transformation and digital care that is going on. But I want to go into, telehealth as well, RPM, RTM, digital devices. I know that my father-in-law wears a heart monitor. That's, RPM. It is monitoring his physical heart and its heart rate. That is digital care. And you've got the mobile apps, patient portals, as well as the care assistants that are out there. So what do you need to know as a healthcare manager related to digital care and how to be compliant? One, know your environment. Know what you have every day in your workday. How's it being used? How are you documenting? How are you ensuring privacy and security? How are you billing for it to ensure that you're staying in compliance with the regulations? So who's using it? How are they using it? Do I have vendors involved? Those are all the pieces and parts to digital care. Making sure that you have policies and procedures and training, again, related to digital care and how that care is being delivered. Monitor and audit these services to ensure that they're being documented appropriately and billed appropriately. And just integrate it into your daily operations. It makes it much easier to address issues when they pop up if you're aware of anything happening ongoing. And I believe that is it for those 3 topics. It's a lot of information, and I feel like I went through it in warp speed, which I probably did, but I know we've got a lot of topics to cover here. So next is healthcare real estate. And what does that mean to you guys as a risk? So Ascension had a notable case, $2.4 million for allegedly, paying providers for above fair market value or providing free services, below fair market value and providing free services. I know this case is dated. However, it still is on the radar for the OIG. They are looking at all services, not just healthcare real estate. They are looking at all services to ensure that they are being appropriately compensated at fair market value. So understanding what that means and how it impacts you is understanding how your hospital or your physician practice is using their space. Does it have a lease? Who is the lease with? Is it at fair market value? Has it been reviewed lately to do a commercial reasonable assessment or survey? It's not required that you do that. However, CMS has stated that they agree it's not a requirement. However, it may be subject to more intense scrutiny if you haven't had an independent survey performed. They want to make sure that they are looking at the terms to ensure that they are reasonable and that they don't always have an automatic escalator. Looking at tenants who are not paying or not paying timely, you've got to make sure that you've got a process in place. They're treated just like any other vendor and that you are receiving payment for the services. Space creep. I want to touch on this one because in many cases, if you've got space that's being leased in the hospital and it includes just this room, sometimes they'll say, oh, you know what? Do you mind if I use that closet over there? I need to store some additional supplies. Or, hey, I've got, My assistant used the space next door for documenting. That's called space creep. You've got to pay attention to it, see how they are utilizing the space in the hospital. And then one that came out in an article not too long ago, and a settlement was made, was utilizing hospital staff to support the physician. And that's one that you need to pay attention to, how your staff is being utilized, especially when it involves a physician that is not employed with the hospital. All right. So what are some best practices? Reconcile. And that's usually going to fall on your financial team to look at the lease and validate that the information that is in there is appropriate and that it is being paid appropriately. Make sure your staff understand, or you as leaders understand, what this means to you, what it means to your department or your area of responsibility. If you don't have a data management or a contract management system, you've got to have a centralized tracking mechanism to ensure when's it going to expire, what's the payment history, any kind of rate escalations that might be in there. And then do walkthroughs. You might be using a third-party property manager to help with the management of the healthcare real estate. So there are many ways to address staying on top of healthcare real estate to ensure that it is compliant. Take a look at some of these additional ways and try to implement them when possible. But it's your responsibility, because that's the government is going to come in and hold you accountable to make sure that you've got good practices in place to manage your healthcare real estate. And I think I'm going to be turning it over to Katie at this point. She's going to talk to us a little bit about EMTALA.
Thanks, Miriam. I'm going to take us through the last 3 risk areas. The first one I'm going to talk about is EMTALA. And I think this is a good one to bring top of mind during the winter months when we're seeing, high flu, high COVID cases, and EDs are full. It's a good time to retrain ED staff on what EMTALA means and what is required of it. Making sure staff know that they need to provide that appropriate medical screening for patients that present with an emergency condition. And understand that it will be costly if you are found to be non-compliant with EMTALA. So making sure that the staff is not turning patients away, making sure they're stabilized, and that if they are being transferred, that the medical benefits outweigh the transfer risks. There can be some gray areas around what is defined as an emergency medical condition. So it's a good idea to get policies and procedures in place, have those discussions so there isn't any question. This next slide, I think, is really important because it talks about the evidence of treatment and documentation. Even, a small lapse in documentation can lead to a major citation with EMTALA. If a complaint is made, there's going to be a lot of people looking to see what was documented, how was the patient treated, that type of thing. So making sure, your hospital has accurate on-call rosters for physicians, making sure you have consistent screening protocols, that you have complete transfer notes and complete stabilization notes, making sure you have your EMTALA signage is really important. And then, like we talked about before, training your staff. It's always a good idea to kind of have those refreshers throughout the year. We included this slide because another area making EMTALA risky or even more gray is the misalignment with state laws. For example, around reproductive emergencies, there's been, a lot in the news the past couple of years around this. And so definitely wanted to touch on it and just reiterate that hospitals still have to remain compliant with EMTALA. They still have to follow federal law. including abortion care if there is a medical emergency with a pregnant woman. The next topic I'm going to talk about is exclusion screenings. So an exclusion screening is when someone, or either an individual or entity, is prohibited from receiving payment from a federal health care program. And that includes services that they order, prescribe, or provide. And exclusion screenings can trigger some pretty serious financial implications, and also some reputational consequences as well. This slide talks about, if a provider is excluded, what are the consequences? Well, first of all, the federal healthcare programs won't pay for those services. Second, the OIG may impose penalties, which may also include treble damages, so can add up very quickly. And lastly, the False Claims Act can have implications as well if it's not addressed timely. On this slide, we wanted to show some recent settlement cases around excluded providers. And I like this slide because it just shows, how quickly it can add up by simply employing one excluded provider. In this last example here, the Kids Peace National Centers of New England, a contractor actually hired the pathologist who was excluded. And so it wasn't even the organization who did the hire. It was accidental, but it resulted in quite a high settlement agreement. So how do you prevent employing somebody who is excluded? It's important that you're conducting internal exclusion screenings. And that doesn't just mean your medical staff department. It means looking at your contractors, your vendors, and your third parties. And it's continuous. It's not a one and done. You want to make sure you're looking monthly. So make sure you have a strong process internally, identifying who's going to run those exclusion screenings, who's going to maintain the documentation of those exclusion screenings, and how are you going to ensure your provider listing is up to date every month.
One of the things to consider as well, Katie, especially on this one, and I had this one happen to me in my previous life, is understanding that you need to be doing exclusion screenings on anyone who is ordering services from your hospital. That includes any physician who is ordering a lab from your hospital. So you've got to have a process in place to understand who are those providers and obtain the information so that you can run an exclusion screen on them. I think you even said at point of care in the previous slide. So, or on that slide that you're on, actually, point of care is because sometimes you don't have good line of sight to them. And usually the people who are doing the exclusion screenings may or may not have any line of sight to it. So what is the process? How are they going to get the information? Is important to have a process in place so that you can run an exclusion screen on any provider that is ordering services out of your hospital.
Absolutely. Thanks, Miriam. So continue to confirm that your processes are working. Test your process, test your design. And when you do identify an exclusion, make sure you have a strong process in place on how you're going to respond. Because when you do find someone, you're going to have to act quickly. It may mean taking a provider out of patient care, or maybe they're not able to order services, or maybe they have an oversight role. How are you going to pivot and still take care of your patients without that provider, knowing there could be schedule disruptions or that workload needs to be redistributed? What systems does the individual need to be taken out of? Is it the EMR? Is there any other system? that needs to be looked at. So the last topic we're going to talk about today is reimbursement pressures. I think everyone can relate to this one. Reimbursement rates are just not keeping up with inflation, and margins are tightening, even when volume is stable in organizations. And I think a lot of organizations feel the administrative burdens placed on them. Here are just a few examples of those. Denial management, technology costs keep rising. The prior authorization requirements keep getting more complicated, and billing rules are always changing. It's a full-time job just staying up to date on those. There's an expectation to provide value-based care, but that requires infrastructure, which isn't cheap. You have to invest in care coordination, data analytics, and the savings are not promised. There's rising labor, drugs, supply costs, and reimbursements not keeping up. And then there's the payer scrutiny. It seems, even in recent years, we've seen an uptick in auditing and recoupment. So, trying to stay on the offense with those.
One of the things as well, Katie, related to the reimbursement pressures, which is why I think we are seeing more and more artificial intelligence tool implementation, is to assist with provider efficiency. And I've heard that several times over with, the ambient listening, being able to pull the information directly into the electronic health record to help the provider with more time and more time to allow better quality of care with the patient. I've had some providers actually tell me, I'm not treating a computer, I'm treating a patient. So how can I do this in a more efficient way? Because the payment rates are not as adequate as they need to be. But again, implementing AI tools is not an insignificant cost either. Actually, some of the tools out there are quite expensive. I think that may change as we move more and more into artificial intelligence to allow providers that opportunity to have a tool to assist them and to provide better quality of care to these patients, because that's actually what the government is looking for, value for the care that's being provided. So, but you're right, the reimbursement rates are a challenge in a lot of organizations.
Mm-hmm. Exactly. Well, we'd be remiss if we didn't talk about the best offense with all of these risks we've talked about. And like Shannon mentioned, there are a lot more we could add, but it's so important to have a strong compliance program in place, starting with support from the top, support from your board, your executive leadership, and then kind of having all these pieces fall into place, making sure there's a place for employees to report concerns, making sure they're investigated appropriately, those investigations are being documented, and that you have a strong auditing and monitoring function in place to test for all of these different areas. With that, I'm going to pass it back over to Jen, who is going to close us out.
Thanks to our presenters, Shannon, Miriam, and Katie. The slides and recordings for every episode of PYA's Healthcare Regulatory Roundup series are available in the Thought Leadership section of PYA's website, pyapc.com. While at our website, you may register for other PYA webinars and learn more about the full range of services offered by PYA. On behalf of PYA, thank you for joining us. Have a great rest of your day.
Thank you for listening to this PYA webinar recast. The video recording, slides, and associated material for this and all PYA webinars are available on our website. If you have any questions or if we can help, please contact us at pyapc.com. Thank you again for joining us and have a great rest of your day.